The Church is interested in future care planning because it's trying to help everyone, the whole of the society, find their way between two extreme views, both of which I think are mistaken. So on the one hand, there are some people who think we should make no plans at all. We should simply live our lives. We die when we die. It's all up to God. The other extreme, which is probably more common in our culture now, puts all the emphasis on personal autonomy. So advanced care planning, I think, is part of that good stewardship. It's part of taking responsibility for my life. It's recognising the limits of medicine, the limits of human endurance, the limits of what people can reasonably be expected to do. So it's about recognising those limits and therefore at times choosing not to have treatment or to stop a treatment. This is all perfectly reasonable and responsible.
The new CHA document really prompts those questions as to what their values are on these things. So if somebody has an advanced disease process, there's something they don't want, they can be clear about it. If somebody's in an advanced state of disease, they may well be part of that discussion. And they may well agree with the doctor that, look, I'm so far along with the disease process that if I arrest now, I don't want them doing all those things.
And the most important thing is you create a space or an environment for these conversations to occur. And that's done by making sure that the setting is right, the time is right for the patient. And I always say the most important things for a good consultation are your hands, your eyes, your ears, and a chair. And creating an environment through the tone of your voice, the posture that you take, the sensitivity of the language that you use can actually allow for some of the most sensitive, and I use the term magical conversations to occur. And even though others are present in the room, it feels like it's just you and the patient. And they can elicit their greatest fears or anxieties or worries to you. And with that information, you can help them formulate a plan, making them aware that the control always remains with them and with their family. If things change, we are flexible. If they're unsure, we revisit.
The era of advanced care plans, advanced health directives, enduring powers of guardianship, medical powers of attorney, this era has introduced a layer of complexity around clinical care, particularly in acute settings, which can make life difficult for clinicians. So it's important, I think, to understand and to acknowledge and to talk about the concerns that clinicians will have as these different instruments become more common in clinical practice. I believe that the best medical care is provided when both the clinical knowledge and expertise of the clinicians and the patient's capacity to understand and make decisions are brought together.
We talk about holism, but we do a lot of tick box things, and we separate roles like pastoral care and nursing and the entertainment type stuff that we often do in diversional therapy. And yet the person's fundamental values about what's important to them are valuable for all of those roles, and advanced care planning can bring it together.
So one of our pillars of being good physicians and clinicians in palliative care is about our ability to communicate effectively. We see it as our scalpel, it's our surgeon's scalpel, is our ability to communicate. And I recognise then me personally, I've got a lot to then offer in that space, and we need to claim that space. If we do this well, like a surgeon uses their scalpel well, we need to be able to influence and affect change. So for me personally, it's great to see an organisation where I work like St Vincent's to adopt a policy. 3 years that took us to get to that point. So that's the exciting part. Having it develop the actual program is exciting, but still coming back to the fact that we have meetings now when a surgeon will come up to me and say, now I understand what you're talking about. Now I know what this is all about.
Advanced care plans are a way of enabling all patients to have a say in their health care in the event that they become non-competent, unable to make a decision at the time the decision is required. For that reason, I think this is a very important project. It's really about providing maximum confidence, both for the patient and for the healthcare community, that the best outcomes are being achieved for the patient.
I've been working in palliative care for 18 years now, and one of the things that have really struck me is that if it's worth doing 6 months out of death, then it's worth doing now, in this time, in this place. And I think we're at the cusp of the shift, where people will begin to want to be in charge of how their plan is towards the end of their life.